Hi, good morning, everyone. My name is Michael Brown. I work on our corporate development team at Worx at CareFirst Blue Cross Blue Shield. Worx is the innovation and investment arm of CareFirst, and we are looking to build, partner, and invest in companies that are helping make healthcare more innovative. I'm joined here today by Dr. Toyin Ajayi, the Chief Health Officer at Cityblock and co-founder, and George Aloth, CEO of CareFirst Community Health Plan DC, the managed care organization serving our Medicaid enrollees in the District of Columbia. So welcome, guys. Will you please give a short intro? George, start with you.
Thanks for having me today. As mentioned, I'm the president and CEO of CareFirst Community Health Plan DC, which is the Medicaid MCO here in Washington, DC, owned by CareFirst Blue Cross Blue Shield. We've been in business in this market since 2013, very proud to serve some of the most vulnerable members in the district. We take a lot of pride in the services that we're able to offer to what we call our extended family. So we've been here for quite some time and looking forward to working closer with Cityblock as the years go on and providing even more enhanced services to the communities that really need it.
Awesome. I'm Toyin Ajayi. As Michael said, I'm a family physician. I continue to practice seeing patients in my community of Brooklyn where I live. And I'm also the co-founder and the chief health officer of Cityblock Health. We're a value-based provider of primary care, behavioral health, and social care focused on individuals with complex needs, primarily folks who receive Medicaid or who are dually eligible for Medicare and Medicaid. Our mission is to radically transform the experience of care and healthcare outcomes for marginalized and underserved communities. And we've been really delighted to be in partnership with CareFirst. We launched our partnership in October of 2020. It aligns very much with our mission and our vision to continue to improve outcomes for populations that have the most complex needs.
Thanks, Toyin. That's right. It's interesting that our whole relationship and partnership has been in the COVID-19 pandemic times, introduced in April. 6 months later, we were up running in the district in October. So really all we know is how to operate in these times. And I would love to continue to talk a little bit about how you've adapted and the immediate needs we've seen in the community as we sit here just on the 1 year anniversary of the COVID-19. You know, the numbers continue to be staggering. 29 million cases affected, over 530,000 deaths, and light at the end of the tunnel of 40 million people being fully vaccinated. But we would all like that to come sooner. We think that COVID-19 has highlighted what we already thought of inadequacies and gaps in healthcare for our most vulnerable, underserved populations, people living in highly dense cities, people living in a crowded household with multiple generations, people that were not able to work from home and had to sacrifice their health every day to show up to work or potentially lose their job. So I'd love to talk a little bit more about how we saw COVID impact those members of our community and what we were able to do to help and change and really continue to increase their health experience. I would love to talk a little bit about how and what we were excited about with the Cityblock partnership here with CareFirst Community Health Plan DC in the use of technology and the importance of being in our community. Both of these companies that you run are very community based. And how important is that to have a presence in the community for the people that you serve? And then how are you marrying technology with the human-centered care to really not replace human-centered care, but augment and further support human-centered care? Worx is excited to bring CHPDC and Cityblock together to have this discussion today. So I'll continue to put it back to Toyin of we hear that the fast growth that Cityblock has had over the last 3 to 4 years, and that's super exciting to see. And you as a co-founder, what was the impetus for the Cityblock construction and company there? And then how has that changed as you've seen it over the last couple of years?
So as I said, I'm a family doc, and Cityblock really was born out of a very deeply personal desire to see healthcare done differently for people who need it the most. I started my career in community hospitals and safety net community health centers, practicing in a traditional fee-for-service environment where I saw patients come back in over and over and over again with worsening sequelae of chronic physical health and mental health needs that were created by all of the systemic factors that we understand and that we're increasingly talking about even during the COVID pandemic: structural racism, lack of access to education, lack of access to safe and nutritious food, lack of access to housing, all of the kind of systemic and social factors that cause communities of color, low income communities, folks with disabilities, folks who struggle with mental health and addiction to be at much higher risk for poor health outcomes. And what I saw was a healthcare system full of well meaning people who were incredibly well trained, but who were structurally not set up to break that cycle. And my patients kept coming back over and over and over again into the hospital with terrible and expensive to treat consequences of things that we could have intervened on much, much, much more efficiently upstream. For me, that sort of catalyzed a career of trying to get upstream, trying to understand how to leverage all of the resources of our healthcare system, particularly for poor and marginalized communities, particularly folks covered by Medicare and Medicaid, to invest in value-based systems of care where we have the right incentives and the right tools and resources to provide primary care, behavioral health services, social care, really that meet people where they are in the community as a way to try to keep them from having to come to the hospital to get expensive and reactive care that's far, far, far too late to meet their needs. Cityblock was born out of a desire to do this at scale. When myself and my other co-founder, Aya Ram, looked around the country and saw that there had been a number of really innovative and promising initiatives, including one that we, co-ran in Massachusetts called Commonwealth Care Alliance that did this for smaller numbers of people, 10s, 20, 30,000 members, either through a health plan chassis or in a value-based provider ecosystem. We thought there was an opportunity to bring technology, primarily through data, analytics, patient engagement tools, as well as tools to scale decision support and knowledge for care teams in a way that allowed us to really transform the healthcare ecosystem, to do this massively at scale. And so our ambition has always been to partner with folks like the team at CareFirst who share our value system, share a set of members and population who are deeply underserved, and share our desire to change outcomes for them and with them, and bring our clinical skills, our care management skills, our social care skills, our tools and technology, and focus those resources on the communities that need it the most in order to drive outcomes for engagement, for member satisfaction, and importantly, for spend and for utilization. And so this has been part of an intentional journey for us. And we're just delighted to have found in CareFirst a partner who really shares all of the things that we value and gives us an opportunity to continue to grow our impact.
Yeah, it resonates, and it's clearly market validation that when you're breaking the mold and you're doing the aligned incentives of value-based care, plans are recognizing that, health systems are recognizing that we can all win together. George, you've been with the Medicaid plan since the early days, right, as trusted health plan, which was deeply steeped in the community as well, a very valued, trusted member of the community. And we were really excited to be able to bring it on under the CareFirst family of plans. Could you talk a little bit about why and how we were excited to partner with Cityblock because of the value-based care model and how we think about success together now that we are aligned in improving the health of this population here?
When we first began on this journey, we had this new contract that started in October where we were taking on a whole new set of members that hadn't been in managed care. It was a whole new challenge that we had to think about. Not only were we doubling in size, we were taking on members that were much thicker than the population that we typically managed in ordinary TANF Medicaid. When looking around at partners that could help us take on this population, Cityblock really stood out because they were specialized in this population. So they weren't a Medicare company that was trying to do Medicaid. They really were focused on this population. When we met, it probably took one or two calls, Mike, which you were a part of, where you could just see the synergy was there. Their culture, their passion for serving this community is aligned exactly with ours. So much of the success of the partnership depends on how we can work together and if we have similar working styles. Cityblock, much like CareFirst Community Health Plan, is made up of not just leaders, but all employees that really are here to help these vulnerable populations get healthier. And it's obvious in the work that they do. We can't be successful without them, and they can't be successful without us. And the synergy between the two organizations make this work. I think that's something that we were really excited about early on. And now 6 months in, it's starting to pay its dividends, and we're starting to see why these similar passions and similar styles is going to be really successful in this market.
Yeah, and this is for both of you. Could we talk a little bit about how we collaborated together on COVID? I think about being a contract holder of the district. Was there any help for testing or for vaccine rollout? Was it that we were on our own? Could you talk a little bit about how we've collaborated or try and brainstormed to tackle such a new challenge?
I think that the initial reaction when COVID was happening, and as we worked our way through the pandemic and got to the point where there were vaccines, there was this assumption that our members would not want the vaccine. Historical things that have happened in the past, these Medicaid members, they don't want the vaccine. And there was a struggle to sort of fight that stereotype. And so what we did is we both have highly engaged outreach teams where we're talking to members, right? So instead of looking at data and hearing anecdotes, we're actually talking to the people in the community, and we're talking to the people in the community with other people that are from the community. And I know that's something that both of our organizations do, is that we like to hire from the community. And what we found is that the majority of our members did want to get the vaccine. They were interested. And there was actually a very small amount that was adamantly against it. Almost all of them were open to it, and the majority of it really wanted to go and get that vaccine. And so for us, what we needed to do was making sure that we were engaging with all of them and making sure that they understood how they could get access to it, how to work through the portal here in DC, whether it's through the computer or through the phone, but really walking them through the process. And we've been really involved with a number of organizations in our market that are helping get access for our members, whether it's through the FQHCs, whether it's through the pharmacies. Getting direct access to our population has been critical. And Cityblock and CareFirst Community Health Plan have put a lot of work into making sure that we're making both of those happen.
Yeah, I would agree with everything that you said, George. This is a health equity issue. The members that we serve, they're all folks who are low income. They're folks who disproportionately come from communities of color. And we know that when we talk about trying to eliminate disparities in health outcomes, what that means is going the extra mile to make sure that you're meeting people where they are with the additional tools they need to achieve the same level of health and well-being that others who don't have the barriers that they have possess. George, you put it so perfectly. It was not just logistical barriers. It's not just, hey, if the only way to sign up for a vaccine is to go online, put in a whole bunch of information, fill out a bunch of forms, print them out and take them over to get your appointment. That's a barrier in of itself. We have a lot of folks who don't have access to data or to computers, or who don't have the technology or frankly the flexibility in their days to go wait for an hour or 2 hours to get a vaccine. Those are logistical barriers we can overcome. But there's also fundamental kind of perception and stigma that even pervades a lot of the language we've seen being used to describe kind of vaccine hesitancy amongst communities of color. That implies something about the way that people make decisions that actually wasn't borne out in our experience at all. And so really talking to people, recognizing that everybody wants to get past this pandemic. Everyone wants to be able to hug their grandparents, go back to getting on the subway safely, go back to being in person together with your family at the barbecue. And sometimes folks need to hear messaging and to receive education in language they understand, delivered by trusted messengers. So folks from the community, folks who look like you, sound like you, who are coming from the same place as you, who can address your concerns without judgment. And actually, if you do all those things, we're finding that the desire and the uptake of vaccines amongst communities that were previously thought to be hesitant isn't there. Like, people are taking them up because they want the same things that everyone else wants. They want to be healthy and they want to get past this. And so being willing and able to go that extra mile to achieve health equity, to eliminate both structural barriers and perception barriers and cultural barriers, and help make sure that our members are equally able to access potentially life-saving interventions. That's the work we're doing together. The vaccine is a good use case for that, but the same applies for trying to help our folks with diabetes make sure that their sugars are well managed, trying to help our folks get their preventive care done, trying to help our folks get access to behavioral health treatment when they need it. And it's really, really important. And I think together, the combination of Cityblock and CareFirst's deep community relationships and trusted reputation is a really powerful force to make sure that our members get what they need.
We've seen something during the pandemic that we see always. Some of the misconceptions we see in the Medicaid market is these members don't care. They don't care about their health, right? Look at the no-show rates for appointments and things like that. The reality of it is the reason that there are high no-show rates in Medicaid is because they face challenges that a lot of us don't. Sometimes when there's appointment scheduled, they can't make it, right? So those same challenges were really exacerbated through this pandemic. It's not a lack of desire. Folks want to be healthy. We've seen that before the pandemic. We're seeing it now during it, and we're going to see it still after it. And our goal is to try to bring down that barrier.
Talking about that importance of trusted relationship and how to share that education, and then it resonates and potentially catches on. Toyin, as you've looked at other markets and we're completely standing up the organization in DC. George, we've had the organization here for a few years. What relationships did you lean on, and how did you start to field a team all remotely amidst COVID in DC to have those trusted relationships so that you could call members as Cityblock or call members as CareFirst, and they would pick up the phone and say, "Oh, I understand what you're trying to do for me. Yeah, I'll sign up and participate."
Our DC market is the second market we've stood up in this pandemic. We've had the opportunity to learn a tremendous amount through that experience, but the same tenets hold true for us. As we enter a market, we enter with humility. We believe that trust has to be earned. Just as much as there are challenges that a lot of these communities face, there is so much power and resiliency and positivity that exists within these communities, and being able to harness and leverage those is so powerful. We start any new engagement in a new market by just meeting people, meeting community leaders, starting to recruit a team of folks who don't necessarily have clinical licensure, but do have this deep kind of commitment to supporting and to achieving better outcomes for their communities. Folks who are community experts, who are resilient and tenacious and compassionate, and who just want to work in there and serve their communities. And then, we've been really fortunate with the CareFirst relationship in particular, because CareFirst has such deep community relationships and such great reputation and brand awareness. We've been able to really lean on those partnerships as a way to help us enter a market. And so our key components are, show up humbly, ask for permission, and earn the right to serve these communities. We consider that a privilege. And then lean on partners, because they have built trusted relationships that, if they allow us to leverage them, can give us a way to enter in a market better. And so those have been key for us. And I think we've seen that borne out in our early experiences where, we were able to stand up a team of some of the most remarkable people you'll ever meet. They're tremendous human beings who are going above and beyond all day, every day to meet our members where they are and make sure we're closing gaps for them. And we're seeing that show up in our outcomes so far, where our engagement rates, our ability to actually help navigate through a really complex healthcare system for our members who need it, to get them to the care that they need within the community. And then the partnerships we're starting to build with community-based providers. It's painstaking work. It requires effort and time and commitment. And we know for sure that this is the only way that we will be successful in achieving outcomes for our members, is by doing this work intentionally.
And George, similar question, stepping into the CEO role, putting on your leadership hat in charge of such a mission-focused organization, what were some of the new challenges or things you've brought to onboard and grow the team, as well as stay so focused amidst chaos of what was 2020? A little bit that you could share there.
So it certainly wasn't an easy year. We were getting a new contract, and it wasn't just any new contract. All of a sudden, again, doubling in size, taking on a whole new population, and doing all of this in the middle of a pandemic. I think one of the things that I learned early on was that we have to find the right balance. So for us, we ourselves were a startup organization, much like Cityblock back in 2013, and we grew. And one of the things that when you grow and eventually you get acquired by a much larger, sophisticated organization like CareFirst, Blue Cross Blue Shield, is that you want to get as much as you can from this larger organization, but you also don't want to lose your roots and what made you successful. There's a balance that you have to find. We need to be able to use data and technology at levels that we weren't able to do as a small startup. Now we have access to that through CareFirst, Blue Cross Blue Shield. But we don't want to lose what we've always done well, which is being that trusted community partner in Ward 7 and Ward 8, where our members are, with our wellness centers, making sure that you use data to try to understand what our members want and need, but then you're also talking to our members to understand what they want and need. The big challenge since I've taken over is to shift our culture to think somewhere in the middle, where you're not completely a fully scaled national organization that has no local roots at all, but you're not the startup anymore. You're somewhere in the middle, and you got to be able to take the best of both worlds. And that's really been the challenge that we face since I've taken over last year. But the combination of both has really made us well positioned to really manage these members in the best way possible. And I see that in Cityblock. It's almost like looking in a mirror, because they're in that same boat where they haven't lost the flavor of a small startup, but they have so much sophisticated technology that are helping them guide the things that they do. It really is a perfect match.
I would be interested to hear the pros and cons of being fully VC backed as Cityblock versus now into the CareFirst parent there as a nonprofit. Toyin, you would say that your investors have recognized the need to take a longer investment horizon with healthcare, and that these things take time to develop, at the same point charged to continue to grow. Could you share that mix of balance?
We've been really fortunate and thoughtful and intentional about the people we've brought around the business, specifically for this reason. As investors, there's a longer time horizon for sure on healthcare. But the other thing that I think is really important that our investors understand and buy into is that our goal here is scale, it's impact. It is possible to build a big, financially lucrative business in healthcare and not necessarily impact as many people as we want to impact. Our goal here is to radically transform the experience of care for poor and marginalized communities. And there are millions, tens of millions of folks like the members we serve with CareFirst who need and deserve a different experience of the healthcare system in order to achieve their highest and best in their lives and for their families. And so we're playing the long game. We're growing thoughtfully and carefully. We're selecting partners who share our values, with whom we can deliver value mutually, where we continue to get to prove out the model and get to prove out our approach. And we are firmly convicted in the idea that time will allow us to really achieve the type of scale that we're hoping to achieve. We can be thoughtful and intentional about how we grow our business, and we're all pointed towards the same direction. So I'm delighted with the path we've chosen and continue to see it really align towards our goals and our mission.
And could you speak a little bit about scale versus human to human interaction? It's a very local one-on-one to really drive healthcare change in someone's life. And we think throwing technology and having a sexy dashboard is going to move the needle. How has the Commons platform really been a supporter? But then how have you used it, understanding the model? You have previously gone into the home and really done a home assessment and understand what are the day-to-day needs that we can help this individual. But then maybe at a macro level, use a reporting tool to help find the highest area of need or what's going to be the most impactful intervention for that person. So could you speak a little bit about how you've used the Commons platform? What's been successful? What was the niche that you think it immediately solved, and how's it grown over the couple of years?
When we think about the way that digital tools can really impact the Medicaid population, what was really true for me was that the tools were being built for a different segment of the population. They were being built for largely commercially insured folks. They were being built with the notion that people had one problem, and it was an organ system and not like the ecosystem in which they lived. And they weren't being built to drive the type of decision support and action that we think about as kind of trust at scale. When we started to build technology, we really focused on those two buckets. We focused the first on making sure that we were building analytic and data tools that reflected the totality of our members' needs, that biased towards gathering data on social needs and capabilities, as well as behavioral health needs, to drive a 360-degree view of each member that we could use to power decision support around not just their medical needs, but also their social and their behavioral needs, and the interplay between all of them. Because our heads are attached to our bodies, which are attached to our ecosystems and our societies, and the interventions have to be holistic. And so Commons does that. Commons, our platform, allows us to see a 360-degree view of all of our members. It incorporates decision support for care team members across a multidisciplinary team that doesn't just include medical. It thinks of those three prongs of the stool: the medical, the behavioral health, and the social, and ensures that we're managing the totality of folks' needs. And in the second bucket, we really focused our member engagement tools on, again, meeting people where they're at digitally. So that means a ton of SMS, because our members do have smartphones and they do use technology to communicate, but it's not some standalone app for their diabetes. It is typically native apps that look like a totality of a person's digital footprint. And that means that we were texting a ton. That means that any of our engagements have to be omni-channel: phone, video, text message, as well as an app. It means that we're not pushing decision support or pushing notifications to people that assume that all they need is the information and then they can go do the thing, go exercise, go eat better. But understanding that we may need to help folks to exercise and eat differently. And then finally, recognizing that the in-person and one-to-one connection is critical even in the digital sphere. And so making sure that our members know that there's a person to call who's their person, who understands their history and is there to stand by them and with them throughout. Even as we are deeply tech enabled and we're leveraging technology, we can't get away from that real human contact and that human feel of the engagement and the interaction. It's not using tech to replace humans. It's using tech to augment and power that human interaction in a way that allows people to get what they need, when they need it, where they need it, all the time, in a really trustworthy ecosystem that allows us to really have visibility across the population with data-driven insights and analytics for performance management and for team management.
George, I'd be interested to understand from a Medicaid benefits standpoint, are you seeing more acceptance of this type of contracting strategy? Do you think more things like Cityblock are going to continue to grow and evolve within healthcare? Are we trying to do this in other areas and with other populations?
Another big misconception about the Medicaid population is that they're all the same. So you're going to come up with some solution that's going to help everybody. The reality is that's not the case. We brought in Cityblock as a very specialized organization that's going to manage a certain subset of our membership. They are exceptional at managing those types of members. And we've had these conversations as we talk about growing their footprint within our organization. They have a sweet spot where they really feel like they can really manage certain types of members. You can't take a one-size-fits-all approach. You can't put everybody in one box. You got to find these really smart, really savvy, really passionate partners like Cityblock that can manage really well these pockets of our membership.
What are you hoping to advance the Cityblock partnership, George? If we come back 6 months from now, a year from now, what are you hoping we've accomplished together for our members in DC?
Better health outcomes. That is the most important thing that we can do for our members. The better the health outcomes, the better our members are doing. Also, the overall cost and strain on the health system in our market goes down. So if we're doing our job, overall costs for everybody go down, but most importantly, our members are getting into a better place. There's nothing better as a managed Medicare organization when you see members sort of graduate from Medicaid. When their health gets better, their employment situations get better, their housing situation gets better. When they get to a better place in life, where all of a sudden they're saying, we love you, CareFirst Community Health Plan, but we're moving on to commercial insurance that I've been getting through my job now. That is a fantastic feeling for us. So yeah, we're losing members, but we know that our members are in a better place in life because of it. We have to get these members healthier, and that's all of our priorities.
Couldn't agree more.
Daunting tasks ahead, but I think we have the right partners in place to do it. So excited. If there's anything else you'd like to share about the partnership or work we're doing in DC?
In DC, in our market, which is interesting, is that there actually are a lot of resources. There is a ton of access. There's a ton of providers. There's a lot of it. But what's happening is that none of it is coordinated, right? And so it leads to a lot of confusion within the marketplace. It leads to a lot of confusion within the members. That's such a big role that Cityblock is playing. It's so critical because there's not a shortage of resources. It's just the coordination of everything.
We're really excited and motivated not only by the impact that we have on the members that we serve, but also with the knowledge that there are more people like them in our community, more people like them who are fortunate to have CareFirst as their insurer, who could also benefit from the care that we provide and for the services that we provide and for the attention that we give.
Yes, we hope to grow the partnership. It's been an amazing start, and we know that the work is just getting started. So again, I thank you both. HealthWorks is really excited and privileged to be able to bring such devoted parties to the table, and we're continuing to look at parties and business models that really break the healthcare mold and improve the healthcare experience for all. So excited that Cityblock had fit that, and it was just a good marriage between CareFirst Community Health Plan DC and Cityblock, and we look forward to the great work you're going to accomplish. So I think bringing back in a year, everyone should be vaccinated and we can be sitting around the table toying. We'll get some drinks and I'll ask some tougher questions next time. So really appreciate the time spending your mornings with me today.
Thank you, Michael. And I will give the shout out that you won't give to yourself for all the elbow grease on your part that went into making this partnership happen. It's been really great to get to know you through this process and appreciate you bringing us together and facilitating this conversation as well.
Good point, Toyin. This would not have happened without Mike Brown. Yeah, that's a good call out, Mike. You're the man, and you know it. So thank you.
Thanks, guys. You made it easy.